there was like no sign of trauma and also no history of trauma. So here, before you do the ultrasound, of course, like you're going to do your ABCDEs. You work in the critical care part of the emergency department, so you always go through ABCDEs. But first, like I would like to ask you, like, what's your differential diagnosis? What could be wrong with this woman? Go. Not all at once.
Internal bleeding.
Sorry?
Internal bleeding.
Yeah. Because of?
Rupture of an aneurysm.
Perfect. Next?
Hypovolemia.
Yeah, perfect.
Acute heart failure.
Acute heart failure. Yeah, perfect. What else? Okay, so Mike, so first was a hypovolemia, then it was a rupture of the aorta, of the aneurysm of the aorta, and then that's hypovolemia, and third one was acute heart failure. Next? Pulmonary embolism, yes, perfect. What else?
Anaphylaxis.
Yeah, perfect. What else? Yeah. So you have like a lot of cases that, or a lot of probable diagnoses that you can have with this patient. So why would you do an eFAST here? What can you like check out or check in with eFAST? Yeah, perfect. Do we look for aortic aneurysm with eFAST? We look for the fluid, perfect. So we look for the fluid and then we can identify the cause. Perfect. Next, what else can we do from the differential diagnosis that you just gave me? Cardiac failure. So you can see the heart that's like pumping shittily. Yeah? The next one? And also maybe like some fluids on the lungs because of the heart failure. Next. Again? I can't hear you. Can you repeat that? The P sign. Oh, the PE? Yeah. What do you mean by D sign? Okay, we'll discuss about this maybe later because I don't really understand what you meant. But for me, what would be also important would be the tamponade that you could see here. Again, when you do the ultrasound here, when we did it here, actually I'm not going to use it that much. I'm just going to use it for discussions, okay? When we did the cardiac part, there was nothing special there, like the except for a bit of an empty heart. When we did the abdominal part, this is what could be seen. What can you see here on the image there? First, identify the structures, okay? So what kind of structures do you see? Go. The liver, yeah? Next? Yeah, there's a part of the kidney here. What else? Yeah, perfect. What else? Yes, a little bit of fluid, okay? This and maybe this. Maybe this as well, but this maybe and this, okay? What's this? Is this also free fluid? Is this psoas? Is it something else? If it's pumping, it could be the aorta as well, okay? So here, there was some free fluid inside, and this woman was actually bleeding from metastasis in liver. And this is why she got hypotensive, okay? So this was like my first case. That's why I wanted to share with you that you can actually identify something rare, but you cannot identify the problem from here. Like you couldn't see, yeah, this looks metastatic. This like you can't identify this during your FAST examination, okay? Next case that I want to discuss, this was 4 days ago. There was the pre-hospital unit called. They are bringing in a 48-year-old female, which was victim of home violence. They reported some stab wounds. There were like slash stab wounds. Some of them on hands, on neck, and on chest. And there were also contusions on the abdomen. So again, like, what's your differential diagnosis for this person? Like, what are you going to look for? Yeah? Pneumothorax? Yeah, why? Slash wounds to the thorax? Yeah, perfect. Next? Bleeding of the spleen? Why? Because of the abdominal contusions? Perfect. Next? What else? Could you have some more injuries that you could identify with your FAST? Cardiac tamponade, perfect. Yeah. Why? Exactly. Also, don't forget what was my point, maybe additional point here, is when you're breathing, like, your organs tend to move inside your thoracic and abdominal cavities. Okay. So, like, your spleen is not always here. It tends to move a bit. When you're breathing in, it tends to move a bit lower. So just think of that. Even if you see like a contusion here, don't say that, yeah, there's no way that the thorax has been injured. Okay. So just like think about that. So this one, actually, like, the thing that I didn't film was what she had was pneumothorax. So when we did the cardiac examination, there was nothing special. On FAST, it was negative. There was like no sign of free fluid, and there was a pneumothorax on the left side with this. There was a problem because she had like multiple slash wounds here. What can you also damage when you have a few slash wounds here? Yeah, exactly. And you can have air coming from here as well, inside, okay? What we did for her was she got a thoracic drainage here. And what would you do? My question here would be, what would you do with the FAST examination that was negative? Repeat it. Yeah, okay. How often would you repeat it? Yeah, or fluid. Yeah. Okay, we repeated it a few times while the recess was going on. And she ended up having like no free fluid inside the abdomen, and she was admitted to the hospital. So yeah, next case that we can discuss. This was, I think, like 3 months ago. There was a 70-year-old female, and she was a passenger in a car crash when they were driving in the wrong side of the highway. So in the wrong way, not on the wrong side. So it was like a high velocity impact. And the pre-hospital unit reported she was hypotensive on the field, but when she came to the triage, she was normotensive. There was a bruise here on the lower part of the left hemithorax. And she was like a bit confused because she also had like a concussion to the head. So what would your workup be for this person? So look for blood where? In the thorax, yeah. Okay, perfect. How would you look for blood in the thorax? By ultrasound, for sure. Yeah, here and here, yeah. Would you look for blood here? No, usually the fluid tends to go down, yeah. There was no blood. Next.
Tamponade.
Yeah, tamponade. There was no tamponade. Sorry? Okay, nothing special when you auscultate. Like you can hear breathing on both of the sides. Not like no breathing whatsoever. Yeah? What else? What else can you see with ultrasound?
Pneumothorax.
Yeah, there was no sign of pneumothorax. What else? Yeah, for sure. We looked for hemothorax. It was not, but I want to show you again this part. Yes. Perfect. So your answer was that you would check the spleen because there's also a possibility for the rupture of the spleen. And her first FAST was negative, and she was admitted inside the place where we have like kind of like the intensive monitoring, and she became hypotensive again. And we repeated the FAST, and she ended up having a laceration of the spleen with free fluid next to the spleen. So she ended up being operated. So when you see, like my question here is, when you see free fluid in a patient like that, what's your next step? If it, yeah? Yeah, okay, but you see, there is a free fluid there. What do you do now? Like with this case, you have a free fluid inside the abdomen. Yeah, exactly. So was she stable? Was my question. No. So she went there because she was hypotensive again. She was a transient respondent to the fluid challenge. It was like first it was okay, and then she became like hypotensive again. So she went straight to the OR. They removed her spleen, and they like removed, I think, like one of the kidneys because there was also some injury to the kidney as well that could not be seen on the ultrasound. Okay, a few more cases. Oh yeah, sorry, I forgot. This was the picture of the spleen. You know that when I was talking about before, when you first see the fluid next to the spleen, you don't see it that much here. You see it here, and you can see it here. Do you see it? Like there is like a really small amount at first. Of course, when you have like the full abdomen of fluid, you can have like, it's not difficult to put the diagnosis, but when you have like a really, really small part of fluid, it's difficult to see, but like really be careful. Maybe like if you look at that side, because the contrast is a bit better there, you can see the fluid a bit better. Yeah? Okay, a few more cases. You have a 21-year-old. This was something that I had with my mentor, I think like 4 months ago. A 21-year-old female who collapsed at home. She came in. She was talking normally to us. She was hypotensive, and she was reported. She reported that she vomited a lot. So your differential diagnosis. Yeah, okay, it could be rupture of the trachea. Yeah, it could be Burghaave syndrome. She reported no pain here, and also no like difficulty breathing as well. So yeah, but of course. Yeah, of course. So how would you check for hypovolemia? You're gonna do the rash examination afterwards, correct?
Ectopic pregnancy?
Yes, exactly. And she had this. What do we see here? Again, see the structures. What do we see? What do we recognize? The liver, perfect. What else do we recognize? The fluid. There's a lot more fluid here, right, than on the other picture that we had before. What else do we see? That's mostly it, yeah? But if you looked a bit in the other areas as well, you could see a lot more fluid somewhere else. So again, like what's this acoustic window? Where are we looking at? What are we looking at? So at the pelvis, yeah, perfect. What do we see here? What are the structures that we see? The bladder, yeah. Okay, next. The uterus, yeah. What's this? Yeah. And what's this? This is free fluid, yeah. And I think I have one more picture, yeah. This was inside the abdomen as well, so you could see like some guts. which were swimming inside the free fluid. What would your, like you see this, and think again about the differential diagnoses that we had before. Would they change now? Yes, no? Would BIRHAVE be more or less probable? Less, okay. Then hypovolemia, more or less? There is a hypovolemia, yeah, okay, perfect. Next, ectopic, yeah? Okay, and she ended up, we had like really huge difficulties placing the IV lines because she was so hypovolemic. And she went again inside the OR, and she had like an ectopic pregnancy, but it ruptured one of the tubes. So they had to remove the tube as well. So because it was so badly ruptured. But yeah, like again, you helped yourself with the ultrasound. I think I have a few more cases. This is again the fluid. This one was really interesting. This one was communicated to us that it was coming in by the helicopter from like a more remote place, and it was a 65-year-old male. They said they were like drinking coffee, and he suddenly complained of chest pain, and then he collapsed. He was, when the units came there, he was reanimated for a while, and he was then brought, like there was a ROSC in, I think, like quite quickly, but then like they had like on-off reanimations. And when they were coming in, there was like a reanimation going on again. So your differential diagnosis for this person. It's quite wide, so you can like start thinking about it. So, MI, perfect, yeah. Ruptured aneurysm, yeah. Dissection, yeah. Pulmonary embolism, yeah. Tamponade, yes. What else? What could also hurt in this part? Tension pneumothorax, yeah. What else? Okay, we have a few differential diagnoses. So at first, when we said that you start with the heart, when you do the eFAST, you're going to see why. We started with the heart, and we saw, let's see if it's going to move. Can you see? What can you see? Tamponade, yeah. So I'll try to play it again. So how do you know this is tamponade and not just like a normal pericardial effusion? There's no such thing. But yeah, like how do you know that this is something that's really dangerous for this person? Exactly, because the motion of the right ventricle is not that effective. So here, what can you see is this is the left side of the heart and the right side of the heart. This is the pericardium. What is this? Okay, I want to show you another thing. This is going to be from a different patient. If you see this, how is this different to the one before? This is all. Do you also agree that this is also tamponade? Do you agree with me? Yeah? Okay. So again, we see the heart, the left side, the right side, and free fluid. So how is this different? Exactly. So this is more probably blood. Okay? We did the pericardiocentesis on him, but unfortunately, this was not successful, and he died. But like with FAST, you could identify, like, because also like what was here, the main reason why he even got the tamponade is because he got aortic dissection, which went inside the heart as well. So with that, there is not really that much you can do. Okay? So yeah, maybe just, I think I have like one or two cases, and then maybe some more questions for you if you want to. Maybe some more non-traumatic causes. If you get a dyspnoic patient, 70 years old, with a SAT of 70%, your differential diagnosis. Besides COVID, please don't give me any more COVID. Sorry? COPD, yeah, perfect. Would you see anything with COPD on ultrasound doing fast examination? Yeah, exactly. Most probably no. You could see something. I think like 2 years ago, I had a case of a woman who was brought in while being reanimated. And we have done, again, like during reanimation, we've done the ultrasound, and you could see the huge right ventricle. The problem here was that you can't really differentiate if it's due to pulmonary embolism or due to high pulmonary resistance because of a chronic change in the lungs. So here, what you can differentiate is like the thickness of the heart when you see like the huge right ventricle. But here, yeah, for sure you can see, this would be maybe the only case when you can see it with COPD. Next. Not COVID-related, this was 2 years ago. Yeah? Pneumonia, perfect, yeah. What else? Could you see pneumonia with FAST? Free fluid, you could see free fluid. I mean, if you like take a look, you could see some free fluid if you have like some parapneumonic exudate. Perfect, what else? Pulmonary embolism, sure, perfect. What would you see with pulmonary embolism again? The huge right ventricle, correct? Yeah, what else? Yeah, perfect. Yeah, with heart failure, perfect. So edema with heart failure. This was what we could see. I think this is the video. What can you see? Like, first orientate yourselves. If you see the picture, where is this picture? Like, what's the acoustic window for this picture? Probably one of the lungs. Yeah? Do you recognize the structures? What's this? Diaphragm. Yeah, what's this? Yeah, and what's this? This is actually a lot of fluid, okay? And this is the compressed lung that got here. So I'll try to play it again because you can see it, how it changes with breathing. Do you see it? Because here you can see like some lung, and I think I also, no, it's just this video. So when you do it like this, this was a lot of fluid inside. This was actually, he was dyspnoic because he had an advanced stage of cancer. And this was like a malign pulmonary effusion. And this is why he was dyspnoic. So yeah, this would be it for my cases. I try to like maybe get you thinking through the differential diagnoses through FAST to kind of like have something more or less probable. So did you have like any difficulties when you had the FAST examination? Do you need like any more things that I can answer? No? Okay, then I would like wish you to do as much practice as you can, and I hope the lectures were interesting, and I want to thank you for your attention. Chris, thanks.
Are there any questions? Wait, Alex, wait.
Yeah.
Are there any questions? Okay, then we would again thank you very much for your very nice lecture, and there's a small present for you. Thank you very much.
Thank you.
Okay, now the morning program is over, and we can eat now in the canteen of the hospital, but we need to go in 3 groups. The first group is the small group 1 to 5. Your slot is now to 12:20. I know it's pretty quick, because, yeah. The second group is group 6 to 9. Your slot is from 12:20 to 12:40. And the third group is group 10 to 12. from 12:40 to 1 p.m. And please be back at 1 p.m. and then we continue with our afternoon program. Thank you.